towards me. Normally then what I was going to do, if I was positioning her and she was going to stay in this position for a long period of time, I'd have some pillows maybe for her back, between her ankles, between her knees, any place that there might be a bony prominence where she might get skin breakdown, okay? So that's called a log roll, okay? For people that might have a spinal cord injury, okay, that's unstable, or orthopedic problems like a fracture that's unstable, or severe arthritis where anything where she shouldn't or couldn't bend segmental areas, parts, joints, and things like that, okay? So that's called a log roll. The other way that nursing rolls a patient is they'll bend one knee, okay, and they'll bend the knee away from you, okay, and do the same roll, okay, and that gives just a little bit more kind of leverage, all right, and it's a little bit more comfortable when the patient's positioned in this kind of a position, right? Now the way that physical therapists do it, okay, is if there's no contraindications and we're teaching a patient to get up, okay, the steps to have her roll onto her side, if we were trying to get her to sit up over the side of the bed, what is your name?
Lauren.
Lauren? Okay. Lauren, I want you to follow my directions like you can, okay? First of all, can you bend both knees? Real nice. Okay, now I want you to take this arm and reach across your body and drop your knees to the side of the bed, okay? And reach across and roll on the side, okay? It makes it easy for her to roll on the side of the bed, right? Now, if I asked Lauren, straighten out your legs. When you get out of bed in the morning, what would you do in order to get up out of bed and sit up on the side? Just go ahead and do it. Okay, now you see what she did. She kind of did a sit up, and then she spun around and sat on the side of the bed. Now, if I was going to, just scoot a little bit towards me so I don't have to reach across so much. If I was getting her up on the side of the bed and I did that to her as a patient, and I bent her knees, okay, and I did this, and I sat her up and I spun her, okay, you can see what's happening on her coccyx. We've got this friction going on, and a lot of our patients are incontinent and they have frail skin, and she might be in urine or feces or something like that, and if we keep spinning her on her coccyx, she's going to break down, okay? Because the coccyx is bony and it's very superficial. So if I was going to roll her to the side, I would do the same thing like I taught her to do, is I'd have her bend her knees. If she couldn't do anything, I would have her arms across her chest, and key points of control, hips and knees, or hips and shoulders, and I'd roll her to the side, okay? Then, if I was gonna sit her up over the side of the bed, I would reach under her neck, underneath her shoulders, and I'd sit her up without spinning her, okay? And she's on the side of the bed, all right? So that's 3 different ways to turn a patient in bed. Scoot over. All right, so one person on each side of the bed. Patients lay down. Both knees. Okay, and can you lift your butt and bring it over here? Good, and bring your shoulders over here. That's the best way to do it, okay? And you always ask first. If a patient can do these skills and there's no contraindications, you're golden, okay? But move back over that way, Lauren. Good. And straighten out your legs. All right, she's semi-comatose and she's not going to help me at all. So what I'm going to do is I'm going to move her segmentally, okay? We don't want to just grab her and pull her over. Both legs first, okay? And then underneath the hips, and I'm going to lift and I'm going to bring her over this way. Whoops, this bed is like...
The bed's not locked.
The bed's not locked, yeah. And then I'm going to go underneath the shoulders and I'm going to bring her here. Now already she started to assist me, which is good, which is what you want to see from the patient, okay? The other thing, okay, that you can do is use normally when you have a hospital bed, our STNAs will tell us when you make that bed, you put a draw sheet underneath it, right? Okay, and that's for, you know, moving purposes if we need to move a patient side to side in bed. Use the linens on the bed, okay? Oh, she just happens to be on a top sheet too.
There we go, good.
All right, and I'm gonna cross her here, and Lauren, my name is Jim, and I'm just gonna move you to the side of the bed. And body mechanics, again, are gonna tell me instead of trying to lift her, okay, what I'm gonna do is I'm gonna shift my weight I roll this up kind of like a sausage, and I get the heaviest parts, the shoulders and the hips, and I just lean back, and she's here, okay? Let's go back over the other way. Scoot down in bed. Scoot down in bed. Normally in a hospital bed, this is where you're gonna find the patients, in the bottom of the bed. Hospital mattresses are made of plastic. Patients put their head up and they slide down. The bad part of that is they try to get up and she's going to be pushing with her heels, and a heel is another area that's prone to decubiti ulcers. And if she, you know, hospital sheets are made out of sandpaper, and she keeps doing this kind of stuff, and she's gonna wear out the bottom of her heels. So what we have to do is we have to help her up, okay? There's two different ways to move them up in bed, okay? Assisted and unassisted. Assisted is we tell her what to do and we help her a little bit. So what all we're gonna do is eliminate a little bit of gravity or friction up here, and she's gonna do most of the work, okay? So what I want you to do, Lauren, is I want you to bend both knees, okay? And use your arms and your legs to push yourself up in bed. Now we're gonna scoop underneath her shoulders and underneath her torso, and when one of us, can you count to 3?
Yeah.
Yeah, you can. When she says 3, I want you to push up, okay?
1, 2, 3.
Good. What's so funny?
It's slippery.
Very good. Scoot down again. Okay. So that's assisted, okay? If she can't do any work, what we're gonna do is we're gonna take this top sheet, okay, Emily, and roll it up next to her. And we're gonna cross her arms across her chest. We're gonna put one hand up by the shoulders, one hand down by the hips, and I want you to face that way towards the wall. And when, this time I'm gonna say 3, okay? When I say 3, what we're gonna do is we're gonna shift her weight and pull her up in bed, okay? 1, 2, 3. All right? All right, so that's if you have a roll you to your side. So I log roll her over this way, get in here, and I want you to take this and open it up a little bit, but I want you to leave it folded the long way, okay? So open it up. It's folded here, and I want you to tuck half of the sheet underneath her. Just push it, push it, push it. Give me enough. Open that up so it's towards you. Mm-hmm. See, you got a lot, so give me a little bit more. Don't short sheet me. And it should catch her at the shoulders and the hips, okay? Where we want it, okay? All right, then I'm gonna roll her back, and you're gonna roll her towards you. Okay, so cross her leg, roll her that way. I'm gonna pull this here, okay? And you're gonna roll her back onto this sheet, okay? If we were making an occupied bed, then I'd shove that underneath and tuck it, but what we're gonna do is we're gonna use it as a draw sheet, so we can roll it up this way. You still have more than me. You're a greedy young lady. Okay? And then we would move her up in bed, okay? So that's the right under butt where it needs to be, and you're gonna hold it there, okay? You ready? Okay, and I'm gonna roll her back onto it, okay? Right. And then if we can, we'll raise the head of the bed a little bit, put the bed rails up, leave the room, give her a way to get a hold of us, okay? Want to give her a little bit of privacy for what she's doing, okay? When she's done, this is the, okay? This is a chucks, and what you're gonna do, just put that aside for now, okay? Is I'm gonna roll her, but you have to reach under there and stabilize that bedpan so that it doesn't tip, okay? Can you do that?
Yes.
All right. Again, gloves, okay? 2 hands on the bedpan. Good, you got it? Okay. Cover it with the chucks, open that up and cover it. And then you would take and dispose of it. Do your measurements. If she's on I and O's, intake and output, you might have to measure the urine. You might have to make a comment on whatever's in the pan, and they'll teach you how to do that if you get into whatever profession you're in, okay? So usually color, amount, smell, blah, 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 blah,
I
blah.
told you, we just finished the digestive talk, the digestive system, and then you have to pay attention to poop.
Oh, absolutely, yep. You comment on that. Why odor? Why would you comment on odor?
I didn't talk about that one.
You know, it's just kind of, anybody ever, that's called a bridge, okay? 90% of patients can do that, even our stroke patients. Okay, straighten that leg out, okay, and lift your bottom up, see? All right, and that's one of the first things that most patients learn how to do. If they can do that, we're good, okay? So bend the other knee. I want you to lift your butt, and we slide this underneath here, okay? And we put her on it, okay? And we raise her head up, if we could, okay? And then put the bed rails up, leave the room, call bell, okay? When she's ready to get off, it's the same process in reverse. Cover the bedpan, take it away, do your thing, okay? And help her clean up if she needs to help be cleaned up. You do? That's all right. And cross them this way. And Matt, what you're gonna do is you're gonna take all of that and tuck it over here. Everything that's on here.
Kind of like what you saw Emily doing. She was tucking up underneath the patient. You see, okay.
Both sheets. There you go. All right. Now, normally what would happen at this point is Matt would go and he would get a new bottom sheet, whether it be fitted or regular, okay? And he would put it on his side of the bed.
Can't we use this one?
Well, we can take off her top sheet.
Yeah, just to show,
Okay.
kind of.
Right.
So here's the new sheet, and he's bringing it over. So watch how this transition happens. It's like magic. So if you have a college roommate and they can't get out of their bed, you're gonna learn how to make a bed for them.
Okay. And then tuck that real nice up in here so it doesn't slide off. We got slippery sheets, don't we? All right, and then I would roll her back here and Matt would roll her towards her. I'm gonna strip this off. Okay. Matt has already taken off one of his gloves. Now I would take off one set of my gloves. Okay. And I would make my side of the bed. Okay. And then we would roll her back onto the bottom. Now, also underneath here would have gone that draw sheet and maybe an incontinence pad if we needed. Anything that we needed help, okay? And I say, Emma, scoot forward in the chair. She can't do it, she doesn't do anything. What I'll do is I'll kind of rock her and bring her forward, and then rock her and bring her forward, and then lean her forward. I'm gonna get down here like I'm gonna do most of the work. Matt, what I want you to do is I want you to grab her gait belt there, okay? And when I say 3, you're gonna lift and swing her butt into that chair. Don't do anything. 1, 2, 3. Okay? Because I'm gonna get underneath her arms here and grab her by the wrists and be up around her thorax area here, up around her chest. And Matt's gonna scoop her legs, and you're gonna get up, just scoop them from this side, both arms from this side. Here, there, and get up underneath her thigh so you can help, okay? When I say 3, we're gonna lift her into this bed. 1, 2, 3. Boom.